Other news now, and a mental health trust that was once named as the worst performing in the country has said its latest CQC report is the best it's received in a decade.
Community-based mental health services under the Norfolk and Suffolk NHS Foundation Trust have gone from requires improvement to good.
But campaigners say the trust's crisis services, which remain rated as requires improvement, are still not safe, as Hannah Pettifer reports.
Rebecca McClellan loved helping people. She was a trainee paramedic with the East of England Ambulance Service. But her mum Natalie says when Rebecca needed help herself, it wasn't there. She was struggling to cope with bipolar disorder and had been under the care of the Norfolk and Suffolk NHS Foundation Trust. 2 years ago, at the age of 24, in her flat in Ipswich, Rebecca took her own life. For the past decade, the NHS Trust, which was once deemed the worst performing in the country, has been in and out of special measures. But now, following a CQC inspection in March, its community-based mental health services have improved to being good overall. For Natalie, though, the improvement doesn't reflect the reality she and other users have experienced.
What we're seeing is time and time again the same themes coming through prevention of future death reports. We're seeing the same things coming through their PSERF, which is their patient safety incidents. The same things that Rebecca suffered from were still being cited in January of this year in their patient safety reports.
Despite the improvement in community mental health services, the report says the Trust's crisis services remain as requires improvement. It acknowledged the introduction of a 24/7 mental health helpline and an increase in governance oversight, but said staffing shortages were still a concern and emergency referrals weren't always assessed within 4 hours, in line with national standards.
And this is the first time that the CQC have found not only sustained improvements since last time, but significant improvements. That isn't in any way taking away from the fact that we must act continuously with humility. We still have a lot of improvements to make.
Natalie says she's happy to hear there have been improvements, but is concerned that crisis services haven't changed.
They're the most vulnerable people in our society. They are people that are in mental distress, and they're the people that need services right now. And actually that needs to improve really, really quickly, because that's where people are harming themselves and that's where people ultimately could lose their lives.
Natalie says Rebecca died during the Foundation Trust's journey of improvement, and that only a public inquiry into deaths under its care will bring about real change.